There is some evidence to suggest that physical therapy can be effective when combined with Botox. In this study, they looked at this the association between Botox and physical therapy and their effect on disease severity, disability, pain, and quality of life in patients with cervical dystonia. The exercise protocol consisted of 3 approaches: kinesiotherapy, which is basically just exercise, motor learning exercises, and functional electrical stimulation on the antagonist muscles. The patients received treatment for 4 weeks, 5 days a week, for 1 hour and 15 minutes per session. PT was initiated 15 days after the Botox injection to ensure that its full effect had been reached. The motor learning program consisted of repeated movements in the opposite direction to the dystonic pattern. Patients were instructed on how to perform the movements by physical therapists. Once they were able to correctly perform a movement without any assistance, they would learn a new, more difficult exercise, typically the next PT session. Motor learning implies more skill and permanence than the kinesiotherapy, which is not a term we often use out here. In that, the kinesiotherapy included passive and cervical stretching, so just some basic range of motion type exercises. Functional electrical stimulation involves stimulating the muscles to contract with a machine. Electrodes are placed on the surface of the non-dystonic muscles, so the contraction would move the head to its normal position and induce a functional movement. The aim was to provide adequate input for proper head positioning. Contrast that with something I mentioned earlier called TENS. It's another form of electrical stimulation, but that's just more sensory. It kind of sends a lot of just buzzing, high frequency buzzing into the skin. The functional electric stim actually pulls the muscles back. It creates a contraction. In this study, the PT program focused specifically on muscle weakness, limited range of motion, pain, and motor control deficits. The patients who completed the PT and Botox program reported improvements in pain, disease severity, and quality of life. A similar study aimed to determine if a rehab program improves the clinical efficacy of Botox. 40 randomly assigned patients were assigned to 2 groups, a Botox group and a Botox plus physical therapy group. The interventions included some stretching, range of motion exercises, posture exercises, and biofeedback. Biofeedback is a technique that uses a machine to provide visual or auditory feedback to demonstrate how hard a muscle is working. So put some electrodes on the muscle, and that visual or auditory feedback is silent or absent. You flex your muscle, and then the sound or the visual response will move up in line with the amplitude of the contraction. So it's really good just for feedback, so you know how hard you're contracting. The results were that the duration of the Botox lasted longer in the physical therapy group. The dose needed at re-injection was less, and there was a reduction in one's perceived disability and pain. All right, so seems like PT is not a bad option in conjunction with the current accepted treatments for cervical dystonia. So what about when you get home? What are some things you might want to do just to kind of enhance the treatments that you've been receiving in the clinics? So if you guys want, you could participate with this. No pressure though. But you really want to start with a good posture. Okay, it's just critical for everything. And if we kind of go back to quieting down the nervous system, a good posture really facilitates that. So good posture is that. That's not so bad right there. None of those are really too bad, but there she's kind of hunched forward. Here, like a lot of folks might think that's pretty good, but she's a little bit too extended. She's kind of hinging right there in her mid-back. That's not good either. That's a pain point, it's a stress point. You're kind of disrupting the stability of the core. Let's see, so Good posture facilitates good core stability and an automatic core response from the muscles of the trunk. If you break up what would be considered a good posture, a good alignment, you actually will inhibit muscle function in the trunk. So achieving the best posture you possibly can will ensure that all those muscles in the trunk are engaged. If your core is strong, every other part of the body will be easier to move and will function better. It's really just the idea of having a strong foundation. It's a real kind of cliche comparison or analogy, but it is 100% accurate, spot on. Good posture can also normalize length-tension relationships in the muscles of the body. This is really important too. If a muscle is too long or too short, it won't work correctly. A tight muscle runs out of room to move. It's just bunched up on itself, so it can't possibly contract. If it's too long, it has too far to go to really clamp down in an efficient way and generate any power. Lastly, if you're hunched over, as one example of bad posture, you could be at more at risk for falling because your center of mass is now outside your base of support. If I trip and I'm standing like this, I'll probably recover quickly. If I lean and I trip, I have to yank my whole trunk back over my base of support just to stay upright. So it presents a lot of challenges when you have bad posture. You're just layering on the problems. So if you can address this, it's critical. So as I said, this is kind of what we're going for, but how do we get there? So we'll start from the top down. In the head, we're looking to eliminate this forward head position. So that's not a good position to be in, so if we can at all avoid it, that's going to be optimal. Similar to just hunching over, you put yourself in a mechanical disadvantage if your head is like reaching out beyond your base of support. And just like alignment in the trunk, that's poor alignment in the neck, you'll see the same muscle responses. You'll get elongation of some muscles, kind of rendering them inefficient, and shortening of others. And when that happens in the neck, you can have a ton of pain. Neck pain, you can have headaches, you can also have instability of the upper part of the neck, and that's going to cause a lot of excessive movement. It might be small, because your neck is wrapped up in a ton of ligaments and tendons and the discs and everything. But still, the heads are very heavy on kind of a little neck. So if it's moving around, if that weight pulls the head forward just like a little bit and there's weakness in there, you can just trigger all kinds of pain responses. So what are some things that we could do? The first is tucking the chin. So tucking the chin is a very common way to address this problem. And let's see. When I talk about chin tuck, I'm really looking at the head sitting on that first vertebrae. So I want to make sure that even though I want the rest of the cervical spine fairly vertical, it has like a normal curve in it, it's that upper part of the head that really is the main problem. That's the part that does this. So in order to fix that, all you need to do is slightly tuck your chin. Okay? Don't jam it back. That could cause a lot of pressure on the ligaments. Simply picture the head sitting on the first vertebrae and just kind of roll or spin it forward. So you're going to do that with your finger. That's it. Another way to think about it is elongating the back of the neck. So you're kind of shortening the front, elongating the back. That's it. You could do that 10 times. You want to reinforce that movement. You want to restore that kind of mobility for all the reasons we mentioned. You could do it for repetitions. You could hold it for a minute, but that's critical. And you could do that in any position. Sitting is ideal. If you lie down, you'll be fighting gravity. That makes it kind of difficult. But as you progress, that would be the goal. The stronger that upper neck is, the better stability, less pain, less problems. So Because it is an upper neck issue, there's one other thing that you could do. I'll put the mic down for this. But if you're having a hard time doing it, you could actually kind of lock down or lock out the lower cervical spine vertebrae by wrapping your hands around the neck. So I'll show you. So you do something like this. Where you,
I will hold that for you.
oh gosh, thank you. Thank you very much, Ann. So all you need to do is figure out a way to wrap your hands behind your neck, underneath the skull. So your skull, you'll feel kind of where you have all like the bones of the skull up here. If you just drop down below that, you can kind of have some feedback to where your mid-lower cervical spine is. So that shouldn't move. That's going to stay somewhat vertical. But the head needs to tip forward. That's almost a little bit easier than using the chin as that kind of tactile cue. This is probably a little better, actually, if you can get your hands up there. Same thing, you perform it for repetitions or just hold it for a prolonged period of time. Thanks. If you want to progress that, which is wise, you don't have to go right down to supine or lying on your back. All you need to do is, upon rolling it forward, just change your finger position from the front to underneath, and then attempt to push your neck out of position. Oh, thanks. So, but don't let your finger push it out of position, just hold it there. Impart that resistance on it. You're going to be doing like an isometric contraction, and you just hold it. And it's very subtle, a little bit of movement, like this. Boop. That's all. The muscles are very tiny in that part of the neck, but they serve a critical function. So that would be how you start to get that good posture. Shoulder position. All right, we gotta start at the top and go down. Incidentally, you could also go from the bottom up. That even could be a bit easier, but because we have the sitting posture there, and we're talking about cervical dystonia, I wanted to start from the neck and go down. So, however it works for you, you can do it. Okay, regarding shoulder position, good posture requires that the shoulders are managed as well. The shoulders should never be shrugged. This can result in shoulder pain and atrophy of all the important muscles for shoulder function. So some of us kind of walk around like this. Now I could be exaggerating, but not much. It could just be that the disorder puts you in that position, or just maybe the disorder doesn't do anything like that at all to your upper shoulder or to your shoulders. We just kind of walk a little bit elevated, chest out. Whatever stress can sometimes induce that position. Whatever the reason is, we need to make sure that we don't make that our go-to position or habitual position. Why does it cause atrophy, or why does it cause problems? Well, you could kind of elevate the shoulder with a shrug, or you could kind of fool yourself into thinking that you're elevating it because your hand is moving, say, from point A to point B. You are able to grab a cup off the shelf, but you're not really using your shoulder joint to roll. You're not using the ball and socket. So if you choose to use shoulder shrugging as a strategy, typically your shoulder blade will roll forward, kind of slide forward over the ribs. That causes impingements, and independent of cervical dystonia, shoulder damage just from wear and tear in life is like super common, right? It's incredibly common. It's one of the most common complaints many orthopedic doctor gets, primary care doctor gets. It's a primary disorder we see in the PT clinic. So if you shrug, you'll develop a habit of moving in that particular pattern, and that pattern will create those problems. Now, because you're elevating with those muscles, you're choosing those muscles, you're ignoring the ones that actually are supposed to work. So the muscles that surround your shoulder blade. So you have this trapezius muscle, which is huge. It goes from the base of the skull down to the bottom of the back and over to the shoulder, down over to the far end of the shoulder blade. The middle and lower portion actually lift the shoulder with this muscle kind of like by your ribs. A little bit of the upper. It's not totally ignored in this, but Those are the muscles that you want to use, right? But if you have a different strategy with the upper shoulder and say your deltoid, boy, a lot of shoulder problems. Anyways, but so how do you get into that position, that optimal position? So the best way I can represent it on the slide was just shoulders back and kind of rotate the shoulders down. So essentially all you do is pull your shoulders back, maybe take a deep breath, and exhale, and soften the shoulders, relax the shoulders. That's it. So pretty simple. So you should be able to feel if you're coming forward. It's a very distinctive feeling, and this is something we talked about earlier about appreciating the sensory experience that your body is giving you. This should feel very different than this, okay? So do it properly, retract the shoulder blades and drop them. And you should feel them kind of fall almost into like a pocket. It could be your back pocket, could be like a muscular pocket, but you'll feel kind of like a hard stop. That hard stop should go right down to your feet, or if you're sitting, right down to your bottom. So pull back and down. That's a stable position. You could do anything from there, and you'll have less chance of getting injured. So another thing to consider with the shoulders, sometimes folks, when they pull the shoulders back, they kind of overdo it a little bit, and they stick their chest out. That's not good either, because that kind of breaks that good alignment that we're looking for and good posture. If you're hinging too much in the spine, you break that chain, and it puts a lot. If you're really paying attention to that sensory experience, you kind of, you get a little pinching sometimes in the back. Everything just feels shortened in the back and kind of too long in the front. It's not very efficient. And if you were to experience like some kind of obvious load, like in the back, you get hit or pushed, or if you're leaning against something, you'll kind of like fold over it, and you'll have a hard time like recovering position. So be careful of going too far back in that kind of typical military-like stance. Make sure your sternum isn't like overly elevated. All right, so with regards to experiencing how that feels, going back to that, putting the shoulder blades kind of in like the back pocket, do it one more time with me. Take a deep breath, shoulders back and down, and let them kind of sink into that pocket again. Just want to reiterate that point of feeling them move straight down through the bottom. You should not feel yourself slump forward. I know I just said that, but I wanted to just like mention it again because it is just that critical. You don't want to slump forward too much, and you don't want to like arch backwards. Okay, so that's critical with the shoulders. Okay, the trunk and pelvis position. This might be the most important thing to consider with posture, because it's probably going to make it easier to perform all the aforementioned activities, and undoubtedly puts you in the ideal position to perform any exercise in sitting, standing, lunging, lying down. Any position you can think of can be enhanced if you can manage your trunk and pelvis position. All right, the primary movement to manage the position is something called a pelvic tilt. So a lot of us have probably heard of a pelvic tilt, but basically, pelvic tilt, oh, thanks. Can you guys hear me okay? Okay, so basically the pelvis should move independent of the rest of the body. So if you put your hands over your pelvis right now, okay, how do you find the pelvis? Because some people confuse the hip with the pelvis. The hip is kind of embedded in the pelvis, in your groin, whereas the pelvis is like just the huge structure in the center part of your body. If you just find a point a little bit below your belly button and move out to the side, you'll find a landmark that is your pelvis. But if you put your hands around there and pull your bottom underneath you, and then kind of arch your back a little bit, that's a pelvic tilt, okay? So a diaphragmatic breath, it stabilizes the trunk. It helps engage the entire core, because your core not only includes abdominal muscles, right? It includes the low back muscles. It includes the diaphragm. It includes the pelvic floor. So you've got this kind of like soda can thing going on right here. And boy, when it's pressurized, you are very, very, very strong. It's why, powerlifters and weightlifters, they wear those lifting suits and belts, because they're increasing the abdominal pressure, which allows them to lift, often considerably more than they could if they didn't have that. They're already strong humans, but they could tack on another couple 100 pounds to those lifts because of the increase in pressure. So let's practice this, okay? What I want you to do is put your hand or hands kind of beneath your belly button, okay, on the lower part of your abdomen. All right, and this is actually an excellent picture. There's an inhalation, the belly is passively kind of pushed out by the inhale process, okay? The exhalation would result in the reverse of that process. So, you don't want to actively push the belly out. What's the difference and how can you tell? Well, if you put your fingertips in that spot you kind of grabbed earlier when you're grabbing the pelvis, and kind of, if you can, make sure you're in your good alignment. If you could kind of push your fingers in there and cough, right? Or perform what they call a Valsalva maneuver, where you kind of bear down, right? You could feel muscles kind of pop out there. If you can't, that's okay, we just would need to train that as well. But you should feel some muscles or some tension there popping out. That's kind of like an active process, right? That's the active version of this. We don't want that. Why is this an important distinction? Well, again, maximal core engagement, maximal intra-abdominal pressure, but habitually a lot of us in here might be chest breathers, right? So you kind of pick up the ribs using all these accessory muscles. So we don't want to do that, right? Because that's not good for the core, it's not good for alignment. So it completely disrupts all the things you did just to get to this point. So the practice would be this: hand on your abdomen, deep breath in, and allow your belly to expand. So it's kind of a weird feeling because you're doing the opposite of what you're used to, or socially you're kind of giving yourself a belly, so maybe that makes people feel uncomfortable. There's all kinds of reasons we won't allow ourselves to do this. But keep your hand there and keep doing it. Deep breath in, just like the picture, belly out. Check me out. Couple more. All right. How do you enhance that experience? How do you progress it? Well, if you get really good at it, you could start to kind of control where the breath goes. So you could put your hand out maybe to the side of your abdomen. See if you can expand that part of your abdomen and rib cage. Right? For those of you who are sitting against the back of the chair, see if you can feel your ribs expand into the chair. Right? So this is how you have to start thinking. It's a very active process and it'll yield some good results. All the things we've talked about is to eventually incorporate the chest, but you want to do it in the proper order. So in order to kind of reinforce this, you can put one hand on the abdomen and one hand on the sternum, okay? And take a deep breath. Same thing. Start with the abdomen, and then it finishes with the sternum. But focus on expanding the rib cage, not on elevating your sternum and like pitching yourself back. Remember, the last thing you want to do is disrupt your alignment. The ribs should kind of like fan out. The spine shouldn't like arch back and forth. So we want this going on, not this, all right? So one more time, hand on the abdomen, hand on the sternum, and Breathe in and exhale. Okay? Start with the abdomen, then the upper chest, and then reverse the order. Chest, abdomen. Okay? So that was very much like a function of breathing and just properly breathing, engaging the core properly, reinforcing alignment, and with every exhalation, your body is naturally dropping into the pelvic floor. Bracing or drawing in is different. This is a very active process, so this is kind of the opposite. In this particular movement, which she's doing in a supine hook line, you guys can do it in sitting, is fine. You actively pull your belly button in. So you picture like a string attached to your from behind through your abdomen into the belly button, and you're allowing that string to pull it back, and you're kind of helping it pull back. So another pretty good picture, like how do you show this in a picture? Well, that's how. So you start with your diaphragmatic rest, make sure you're in good alignment, and pull the belly button in. You could kind of reinforce it by putting your fingers at the pelvis once again, and kind of feeling for any kind of abdominal contraction. But so if I pull my belly button in, I could feel the muscles deep in there kind of turn on a little bit. So that's another exercise you can do. Now, here's the kicker though, like you'll see this exercise given as like a core exercise, and it's not all that bad. It's actually a good exercise to do. But if you have good alignment, like we talked about up to this point, you get an automatic core or trunk engagement. So all the muscles that keep you stable, upright, and that are supposed to be on all the day, kind of managing your posture, they'll kick on automatically. If you have that alignment with activity, with exercise, you'll get stronger. You don't necessarily need to do that movement, but bracing and drawing in is a very good exercise to get used to the ability of the muscle to contract. It's a good way to reinforce things. So that's why I wanted to mention it today. All right, a couple more. Daily stretching is important, of course. You got to take stretches slow. You want to stretch it. You don't want to feel any pain. And sometimes you can kind of cross over to that pain barrier. If you do that, sometimes you can trigger a reflexive response, like a defensive response in the muscle, and then it'll kind of kick back or rebound on you. Everything starts with that good alignment we worked so hard to achieve up to this point. Side bending stretch is the first one. It stretches your upper trapezius, the scalenes, and the sternocleidomastoid. And basically, if you want, you can take the hand and gently pull the ear to the shoulder, or you could just kind of actively move your head to the shoulder if pulling on it takes you out of alignment, or if you have shoulder pain. But ideally, you feel a little bit of a stretch, but clearly there's elongation there. So we know that it's indeed elongating or stretching it. But, ideally over time, hopefully you can get a nice stretching feeling. Hold it for 30 seconds. And you can do this, say, like 3 times per session. We won't do 3 sets right now. We can do 1 this side and 1 on this side. Good. So sternocleidomastoid stretch. Same thing, you're going to turn or side bend the head and turn away to stretch the sternocleidomastoid, just like in the picture. And you hold it for about 30 seconds. And remember your alignment. Everything starts with a good alignment. And then the other side as well.
30 seconds per
30 seconds per set. Per set. And you could do, say, 3 repetitions in that set, each side, just to kind of reinforce the stretching, reinforce the elongation.
And how many times per day?
You could do that a couple times per day. So say twice a day. Okay. Levator Scapula stretch. Okay, so for this one, you rotate your head to one side. All right, so I'll demo it first. So I'm going to pick the left side, and then you look down kind of towards the armpit. Okay, well, thank you. Okay, that's it. So why did I include this picture? Well, if you can get your arm up there, okay, you don't have to, but if you can, you'll put a little bit more of a stretch on levator scapula. Okay, this movement causes upward rotation of the shoulder blade. Okay, the levator scapula attaches closer to the spine, so as your shoulder blade rotates upward, the inside part of the shoulder blade dips a little bit. That'll give you a little bit more of a stretch, if you can manage it. And if you want even more of a stretch, you grab your head and hold. Hold for 30 seconds, and then you switch sides. Okay, so let's see, so rows with the TheraBand. So do any of you have an elastic band at home? Like sometimes, like I've got like 100 of these things just kind of like littering my garage and bedroom. It's crazy. So we're going to demo the row, but you could use a TheraBand to add resistance. You don't need this. This is good for strengthening. Of course, we want to get you strong, but the posture is the most important. Setting the proper alignment is critical. This can offer some good feedback because sometimes resistance makes you align things properly. I can tell you if I drop a heavy load on your shoulders, you're not going to stand like this. You'll probably do everything in your power to get under it. You kind of do it naturally. Resistance is really good for that kind of reinforcement. But without the band, because we're all just kind of sitting here today without any TheraBands, all you have to do is pull the shoulder blades back. So why is this important? This strengthens all the shoulder blade musculature. That's all. And it reinforces all the postures that we discussed earlier. So the shoulder position that we discussed in your alignment is reinforced by this movement. So anytime you can do a row, it's good. You have two options. So right now, I just want you to pull your shoulder blades back. Okay? Initiate with the shoulder blades, then the arms. So I don't even care if your arms moved. If you can't move your shoulder blades, independent of, say, the elbows, I actually don't even want you to do a row. You have to get the shoulder blades engaged. Shoulder blades back, followed by the elbows. Now hold it. We're going to hold it right there. We're going to hold it for 30 seconds or so, okay? Now, as you're holding it back there, you should be able to pinch a pencil between the shoulder blades right now. Like, just hold it there. Now, as you feel the position that you're in, make sure that your shoulders aren't elevating, right? Everything should be kind of depressed, right? Shoulder blade tipped back, sitting in that kind of pocket in the upper back there, right? You shouldn't be hinging in your low back either, so monitor that position as well. You still should have all your weight on that pelvic floor. That's the row. Now, because we don't have resistance, you could do a series of 30-second holds, all right? Why 30 seconds? It's more challenging than 10 and more challenging than 20. The stretching is kind of time dependent. Like if you hold a stretch for about 20 seconds, you could see some elongation. A muscle contraction doesn't really have any time requirements. Like you could, if you're using resistance, you're doing like, 1 second per repetition, right? Like 1 and 2 and 3. Without any weight, we have to find other ways to challenge you. This is going to just drive you nuts because it's just too easy, right? But pinching the shoulder blades back and holding it, an isometric contraction where you can actually generate a lot of force even without weight, that can reinforce it. So 30 seconds is somewhat arbitrary because there is no gold standard for that. So don't feel bad if you don't remember the time. It could be 30, it could be 20, but you want to challenge yourself. And you want to give yourself enough time to appreciate and sense the position that you're in. So shoulder blades back and down.
Before we go to another one, how can we lift weight? Because usually it hurts. People who have cervical dystonia, we cannot lift weight. So how can we do it? Can you dwell on that a little bit? We cannot use the weight, right?
Yeah, so the primary theme, one primary theme today was this idea of sensory motor integration and neuroplasticity and that type of training. So if you could focus on that with any of these movements, that would be ideal. If you can't lift weights, that's okay. Weights are not essential. Really, I just want you to reinforce postures and positions, right? I want you to think about which muscles have tone and which don't, or which have been affected by disuse. And if you could possibly, like I mentioned the yoga block example earlier, where you could kind of push your head into a yoga block. So this, or the proprioception, or the mirror box, where you could kind of like move your fingers and move your hands. I would say this is more important than, say, lifting weights or applying a lot of resistance. At home, these are some things that you could consider and you can try. Certainly the posture thing isn't lifting weights. Squatting is very functional. You're doing that regardless, whether you want to or not during the day, right? Getting in a car, going to the bathroom, whatever the case might be. These don't need to be done with resistance. You could just move your shoulder blades back. I would argue that we all do that, whether we want to or not. You're getting milk out of the fridge or pulling the container out of the cabinet. So it's not so much that the weights need to be lifted. However, if you can lift weights or apply a load, that's good. It's good for the body, right? It's good for the body for many reasons. So it's a kind of a do-what-you-can kind of thing, right? There's no expectations here, and there certainly are no judgments. You do what you can with what you can, and just try to get the optimal results and try to be progressive and motivated to do it, to engage in it. Just sitting there and appreciating your position, right? Your sitting position, your standing position. That's more important than a bicep curl with a dumbbell, I think, right? And that's a primary problem with dystonia. It's that sensory motor integration. So those things are more important to focus on than, say, the bicep curl as an example, or applying like a heavy load. Now the movements that I chose here are specific because they involve the muscles that are affected by cervical dystonia. So, that's the idea of the selection, and they're easy. Things like this are kind of easy to transfer into the home environment. We can't do a lot of, you could certainly use a mirror box at home, or you could probably do soft tissue on your neck muscles, but like a typical movement program for the home is very commonplace. The flies, which is the first exercise, and the diagonals, they work the shoulder blade muscles that are important for the upper extremity. And they're especially important because they work the muscles that can be, that can atrophy or suffer from the most disuse with upper extremity function. And they're the ones you kind of need to maintain shoulder health. So we don't need weights with it, but what I want you to do is try to do the fly. So everyone stand. So the first is, I'm going to do it with my left so I don't hit that in with my right. But just remember, assume a good posture. So you might have to pelvic tilt a little bit, find that center position. I've been standing for a while, so I feel my low back hinge a little bit. So I'm making adjustments as I talk because I don't want to live there for the next 10 minutes or 5 minutes. It's not good for my back. So I'm making little adjustments in my pelvic floor, right? Finding that neutral position, sinking my weight into the pelvis, okay? Relaxing my shoulder blades, and then bringing the arm out. okay? Just out to the side like a T. So you're making a T. Think of it as a T exercise, okay? Now, don't shrug the shoulders as you do it. Relax the shoulders. So relax the shoulders, okay? Critical in shoulder function. And remember, this is kind of in that category of the underlying factors of the things secondary. They're still incredibly important, but this isn't causing your dystonia like the weakness in those muscles. It's an effect of dystonia. So we need to work those muscles, and this is a very easy thing to do, or it's relatively easy thing to do. Next would be the diagonals. Now, if you can't lift your arm in a pure diagonal like a Y, that's okay. You guys are, this is absolutely incredible. I mean, look at this. My goodness. So, if you couldn't, or if it was too hard, you could even drop your arms down a little bit, like a touchdown kind of, position. But the idea is that you're moving in the plane of the scapula. Okay, the shoulder blade sits on your rib cage. The ribs are curved. So the resting position of the shoulder blade is slightly internally rotated, like this. So you're moving in that plane. It's a very, well, textbook-wise, it's a safe, anatomical position of the shoulder. It's a great position to start shoulder rehab, the plane of the scapula. So you would move in that plane. You could do this, you could do that. However you could manage the movement will help restore function to those muscles. Okay? Now, once you're up there, though, you have to be careful to adhere to the plan, which is do not allow your shoulders to shrug. The shoulders need to get soft, like relax. So when I do that, I feel my shoulder blade sink right into my rib cage. I feel my rib cage sink into my pelvic floor, and I feel my pelvic floor sink into my knees and my knees into the floor, right? So right here, yeah, good traps on this guy, weightlifter. I wouldn't want to mess with him. But for this exercise, now just relax, soften the shoulders, just drop them. Relax them. Relax the shoulders. So we should see the upper trapezius soften a little bit. So if you can't because of the tone, then other things might need to be done before we can do this activity. That's okay. Remember, there is no specific prescription for this particular exercise. It's an idea. Maybe we got to do soft tissue. Maybe we need to do some sensory motor treatments. Maybe we have to use the cotton ball technique. Maybe there's other things that we need to do to reinforce this, okay? But if it's a habit that can be broken, you got to break it. You just have to drop the shoulders. Oh, yeah. Or how about, let me see, go ahead and lift them up, right up here. And then bring it into the plane of the scapula a little bit. Yeah, it's sweet, perfect. Okay, that's not bad. Okay, let me now drop the elbows, make the elbows heavy. Just relax, don't resist. Just let your elbows sink. Yeah, heavy. Let me support your hands. Okay, you're pulling me down. Just relax. Yeah, that's it. Right there. Okay, now I know his shoulder blade muscles are working and not his upper traps. All right, let me do one more over here. That's right. The perfect squatter right here. Perfect alignment. All right. So come into the scapular plane right there. Yeah. Yeah, so tight upper trapezius. For the purposes of this, not ideal, it's not optimal. Let your elbows sink. I have your arms. You feel safe there, you trust me? Let the elbows drop. Okay, so I feel that you're kind of holding them up. So for whatever reason, we would need to reinforce the idea that you could relax them in this position. It is possible. In so doing, we'll decrease the tension in the upper neck and upper trapezius. So,
John, I think that it is fair that you can do two more here.
Yeah, do two more. All right, let's see. Plane of the scapula. So bring the shoulders, yeah, right there. Okay, hold them there. Okay, without my assistance, can you just soften the shoulders? Can you drop the shoulder? Oh, he did it. Okay, so excellent tone in the upper trapezius. So it's not like there's anything inherently wrong with that, but remember, we're talking about optimal muscle function. So he was holding his arms up with the upper traps. It's exactly what we don't want. Then with the cue, boom, he dropped him. Amazing. Now you know what he's holding his arms up with? With his middle and low trapezius, the serratus anterior. Okay? Rotator cuff probably engaged and probably sucked the humerus into the glenohumeral joint, right? Seated it in its little like socket properly. That's ideal. So you would have less chance of shoulder injury now in anything that you do in life. So good job. That was done without any cueing. So that was perfect.
Now we can.
All right, let's see. So arms up. Let me see. Bring down the plane of the scapula, right? Remember how the shoulder blade sits on the ribs. Man, that's perfect. All right, so you're doing it perfectly. So he's kind of softened his shoulders. He's made his elbows heavy, and he's using his shoulder blades to keep that, or the muscles on the bottom of the shoulder blade to keep the arms elevated. Man, that is perfect. So